Hi, everybody. This is Dr. Brett Talley Daniel, MD, and I am a neurologist and a headache doctor. And today I have for you a podcast on the subject of, does Botox work for chronic migraine? Onabotulinum toxin A, or as it is colloquially known in the world, Botox, is a famous dermatology, beauty-assisting, facial line erasing drug which also works for chronic migraine headache, as has an indication from the FDA for migraine prevention for patients with chronic migraine. And chronic migraine is defined as 15 headache days a month, 8 of which have migraine features. Botox does not work for episodic migraine, which is 14 or less headache days a month, or for tension headache. Botox is a neurotoxic protein produced by the bacterium Clostridium botulinum and prevents release of the neurotransmitter acetylcholine at the neuromuscular junction. This can result in paralysis of striated muscle. That's the normal muscle is found in eye, muscles, diaphragm, arms, and legs. Human infection with the bacterium causes the disease botulism. Marketed in the United States, Botox is used commercially in medicine and cosmetics. So the question today would be, does Botox work for chronic migraine? Onabotulinum toxin A, Botox, has received FDA approval for treatment of chronic migraine on October 15, 2010. The toxin is injected in the head and neck to treat chronic migraine. Approval followed evidence presented to the FDA from 2 studies funded by Allergan, showing a very slight improvement in the incidence of chronic migraines for migraine sufferers undergoing the Botox treatment. Botulinum toxin A significantly reduced the number of headache days per 28-day cycle relative to placebo at week 24. It changed from baseline 8.4 days for Botox versus 6.6 days for placebo. Botox improved health-related quality of life and had an acceptable safety profile. All right, what is the dose of Botox for chronic migraine? Well, the chronic dose is 155 migraine dose. The chronic migraine dose is 155 units intramuscularly divided into 31 sites given every 12 weeks. And I've got this listed on my blog article on this. I'm not going to go into and list all the different units, but that's at www.drmigraine.com. If you're interested, go look it up. So what is botulism? Botulism is an extremely rare disorder which may cause limb and breathing paralysis, sometimes resulting in death. Botulinum toxin is a potential biologic weapon, so the U.S. military is interested in finding an antitoxin or blocking molecule to protect soldiers. The exact structure of the link between the toxin and nerve cell is now known, hopefully making it easier to find a blocking molecule. 1 gram of botulinum toxin could kill over 1 million people. 2 kilograms could kill the entire human population on Earth. Botulinum toxin acts at the neuromuscular junction to cause muscle paralysis by inhibiting the release of acetylcholine from presynaptic motor neurons. Botulinum toxin acts at 4 different sites in the body: at the neuromuscular junction, at autonomic ganglia, at postganglionic parasympathetic nerve endings, and at postganglionic sympathetic nerve endings. Botulinum toxin induces weakness of striated muscles by inhibiting transmission of alpha motor neurons at the neuromuscular junction, and this has led to its use in conditions of muscle overactivity such as dystonia. And it has an indication from the FDA for treating dystonia, which is one of the movement disorder conditions. Transmission is also inhibited at gamma neurons and muscle spindles, which may affect reflex activity. The toxins also inhibit the release of acetylcholine and all parasympathetic and cholinergic postganglionic sympathetic neurons. All right, this has generated interest in its use as treatment for overactive smooth muscles, for example, in achalasia, or abnormal activity of glands, for example, hyperhidrosis. Botulism toxin requires 24 to 72 hours to disrupt the muscle nerve process, and in very rare conditions, some individuals may require as many 5 days for the full effect to be observed, peaking at about 10 days, and the effect of Botox lasts about 8 to 12 weeks. So how does it work? The toxin comes from the bacteria and is used in tiny doses in specific areas to block motor muscle contraction. Wears off in about 3 months. It's common knowledge that plastic surgeons in Hollywood inject movie stars with Botox, and in that circumstance, the toxin paralyzes the facial muscles and eliminates frowns and lines. It's been known that Botox toxin would block efferent, that is motor neurotransmission, but how it helps migraine has not been well understood. But recent articles have discussed that Botox will block the release of a common neurotoxin generated during the migraine process, which is called CGRP, and that helps migraine. So what do the Botox injections feel like? Patients describe the injections as like tiny pinpricks as the needle is going a shallow distance in the muscles in the jaw, face, and back of the head. The drug works best if given in the protocol as described above. Sometimes no migraine relief works on the first try, so it's recommended the patient try it twice. What are the side effects of Botox? Well, there may be problems swallowing, speaking, or breathing. It paralyzes muscle activity. The toxin effects may appear in areas away from the injection site and may cause all-over muscle weakness, double vision, blurred vision, droopy eyelids, hoarseness, change of vision or voice, or unclear speech. On my migraine blog, I mentioned before I've got a patient with ptosis or a droopy eyelid on one side. What does Botox cost? Most insurance companies will cover the cost of Botox therapy, but patients should talk to an insurance supervisor about coverage. And they have to have had chronic migraine that's not recommended or approved by insurance for episodic migraines. You've got to have 15 headache days a month, 8 of which are migraine, to be approved for this. What's the effectiveness of Botox? Allergan, the maker of Botox, says that, quote, some patients in company-sponsored trials experienced a 50% reduction or more in headache days per month after 2 cycles of Botox, and more than 2 out of 3 patients showed some improvement. But nobody else has achieved these results. In an April 24, 2012 article in the American Journal of American Medical Association, headlined that Botox injections are, quote, only modestly effective for preventing migraine in the most frequent sufferers, end quote. The researchers looked at 27 trials comparing Botox to placebo and 4 other studies comparing Botox to other migraine treatments. Botox treatment given to patients with chronic migraine at least 15 headache days a month prevented, here it is, here's the answer, guys, here it is, it prevented 1.8 headaches a month more than placebo. The researchers felt that Botox was no more effective than commonly used migraine preventive drugs, and it didn't work for chronic tension headache, nor with patients with episodic migraine. There's also a high placebo response with Botox. Satnam Nijar, Nijar, MD, a headache specialist at Johns Hopkins University of Medicine, said, quote, the research analysis will surprise few clinicians working in the field. This review emphasizes that most patients experience modest benefits, but we already knew that, end of quote. What are other problems using Botox for chronic migraine? 89% of patients with chronic migraine are overtreating with the over-the-counter analgesics like caffeine, opiates, butalbital, Tylenol, Advil, drugs like that cause chronic migraine due to medication of headache. This syndrome used to be called rebound headache. See my articles on this at www.drmigraine.com. Go to categories, medication-induced headache. I've got a lot of information there you can read. When I see these patients for a second opinion and they're already on Botox, but they're not doing well, I discovered that they may not have ever been educated regarding how taking too much medication can cause headache. The International Classification of Headache criteria for medication-induced headache are triptans or ergotamine over 10 days a month, drugs like sumatriptan more than 10 days a month, non-opiate simple analgesics over 15 days a month for Tylenol, caffeine, or Advil, or opiates or analgesics combined with barbiturates over 10 days a month. A recent patient I saw was getting Botox and taking hydrocodone from the same doctor. And a patient should be educated about medication-induced headache and detox before Botox is ever considered. And most of those patients will pass right into episodic headache and do well. So my Dr. Daniel's advice for good migraine treatment, please consider the following. Do the migraine lifestyle. That's also on my webpage. No caffeine, 3 meals a day, aerobic exercise 3 to 4 days a week for 20-30 minutes. Set your sleep cycle to be the same. Don't nap or oversleep. Deal with stress. Don't overtreat with over-the-counters, NSAIDs, caffeine, or triptans more than 2 days a week. Don't ever use opiate narcotics or butalbital at all. Get on a migraine preventive drug for chronic or episodic migraine. The new CGRP antibody drugs work well. Those are Aimovig, Ajovy, or Emgality. Limit all headache medication to no more than 2 days a week, except maybe DHE or Timolol eye drops. Again, don't take opioid narcotics or butalbital. And as far as I know at this time, there are no drugs comparing Botox treatment with the new CGRP drugs of Aimovig, Ajovy, or Emgality. So that's the end of this talk here, guys. Please click on my subscribe button down there, and I'll see you again on another talk. God bless you all.